Alicia Samuel, what can you do about tinnitus? What can you take for it? Boy, that is a great question, Alicia. Tinnitus, that's that ringing in your ear. It can be on one side, it can be in both sides. It is truly a curse. Oftentimes, people will go to the doctor and they'll get various therapies. I will oftentimes include a steroid injection in the butt, not in the ear, in the butt, that gets into your circulation and goes around to the ear and calms down inflammation. I'll also use a nasal spray because sometimes the tinnitus is due to obstruction in the plumbing of your ear. The middle ear makes a fluid that is utilized to lubricate the three bones in your ear. The three bones in your ear are the incus, the malleus, and the stapes, the hammer, the chisel, and the stirrup. They vibrate. That's what makes you hear. They vibrate against the eardrum. The eardrum takes the vibration, makes those bones vibrate. They go to the cochlea. Your brain interprets that as sound. Okay. Now, one thing, as you age, those bones become stiff, just like all the other bones in your body, and they get arthritis in them. So that is the most difficult etiology when you got arthritis in those bones. When that fluid is not being made appropriately, or you can get to excess. That fluid is made continuously and it drains through what's called the eustachian tube, which goes from the middle ear to the throat, to the back of the throat. And it goes at about this angle. If you take it, point down to your jaw from your ear, that's the angle of that. And sometimes if it gets obstructed, you can feel pain coming from the ear down to your jawline. That is diagnostic of an otitis media when that happens. So when you have that issue, and again, the pain goes this way, down from the ear, down the jawline. When you have that issue, you can open that up with a decongestant and a mucolytic. And so I will oftentimes give a patient something like Mucinex or Mucinex DM that makes thick mucus thin and watery. When that mucus is thin and watery, it will drain easier. You open it up, it drains. Now, a nasal spray helps open up the pipes as well. When that happens, you spray a nasal spray like Flonase or Nasacort into your nose. And you say, why am I spraying it into my nose? The problem is my ears, because the plumbing for your nose and your ears literally meets in the center of your brain, or the center of your skull, rather, not in your brain, center of your skull. So one goes straight back, one goes this way. And so they meet and that plumbing connects. And so if you spray the spray in your nose, it actually gives you benefit to help drainage from your ears on the inside. I'm not talking about drainage coming out of your ear where you have to catch it with some tissue. I'm talking about drainage on the inside to decrease that pressure so that you can help with that tinnitus. Sometimes you have to have tubes placed in the ear because that drainage just won't happen. And so those are called tympanostomy tubes. They literally pierce, they take a needle and stick it through the eardrum, create a hole, put a plastic tube in there that keeps that open so that it can drain continuously and relieve the pressure. Once the pressure is relieved, the tinnitus will improve. But oftentimes you can do a lot of things and still suffer from tinnitus. But tinnitus is an inflammatory condition. I'd recommend taking natural anti-inflammatories like the Doctor's D, the vitamin D3 at 5,000 international units per day. Omega-3 fish oil also is a natural anti-inflammatory, and it also kind of helps lubricates those vibrating bones. So I highly recommend the omega-3 fish oil as well. That combination plus Flonase, Nasacort, Mucinex DM maximum strength. All of these are available over the counter. If you don't get relief from any of those things or all of those things, then you need to be seen by an ENT, ear, nose, and throat specialist to evaluate you to see if you need tympanostomy tubes placed in those ears. Great question, Alicia.